Okay. This is Wade. Wade's been a patient of ours for a number of years, right?
Yep.
And you had some knee issues. You had one replaced, the right knee.
That's correct.
And you were having problems with your left knee as well, right?
That is correct.
Okay, and your orthopedic had recommended replacement on that one?
No, he didn't recommend a replacement yet. He always tells me, you'll let me know when you want it replaced.
Gotcha. All right. What treatment did you do for the left knee? Anything before coming in for Shockwave, StemWave?
Well, I mean, I have several times over the last years used the hyaluronic gel injection, and it gives relief for about 3 or 4 months.
Okay.
Then you have to go back in again. So.
Steroid injections? Any of
Not
those?
steroids. Steroids have never worked for me. It's
Gotcha,
always been
yeah.
hyaluronic acid.
Yeah, and not probably a good choice for chronic issues like that. All right, and so you're a avid, as well as being a local celebrity, a avid pickleball player, right?
I like to play pickleball, and then when I go play golf, I play a lot of golf each round.
Okay, what you're better at?
I'm better at pickleball now.
Okay, so, but I remember when you first came in and wanted to look at this treatment, you were having some problems with pickleball, it was hurting a lot, you were having to wear a brace for some stabilization, and you were trying to get a better option, is that right?
That is right. I really, the thing about the knee replacement is just the recovery time afterwards. It's just no fun. So if I can avoid having to go through the rehab
process,
then that's great.
Okay, yeah, fantastic, and not getting your joint replaced. Okay, so functionally, you were having problems with pickleball. Do you recall anything else? Were you standing for periods? Or
Well, just walking. I mean, movement.
Causing a lot of pain.
Yeah, it was trouble. My wife and I would like to take walks, and it's kind of hard to walk around the block when your knee hurts.
Understood. And when you came in, I had you down at an 8 that the pain level was at. What's the pain level at today?
Well, first of all, just to let you know, I played pickleball this morning, and it's the second time in a row I've played without having to wear any kind of knee support.
That's awesome.
And it did not bother me the whole time I was playing pickleball. It's a little sore now, probably about a 2 or a 3 pain level when I'm walking. I still have to be careful about hyperextending. If I do that, then it hurts worse.
Okay, and we are just around a month of care is what we've taken in terms of the time, and you've done 10 treatments. We're doing a final one today.
That's right.
On the 10th. We had you down at a pain level at 2, a treatment or 2 ago, and you would say you're probably around there again then? And
Oh, yeah. I mean, sitting still. The biggest thing for me has been at nighttime. Usually at night, my left knee would hurt a lot when I'm in bed. And I always ask, why in the world is it hurting me when I'm laying down and not doing anything? And apparently your pain receptors are more active at night. And at least that's what my surgeon told me. And so, but since I've started the treatments, I've had little problems with pain at night. And then also, I'll say this in layman's terms. I know it's crepitation, but I would get up at night, and if I had to get up at night to go use the restroom or something, I would get the popping in the knee where you would hear it pop, pop. And I've noticed for about the last 2 weeks, I haven't had that happen either.
that's awesome.
And so,
That's fantastic.
so the pain was a lot better at night. The pain is now better at day. It's not 100%. I can't tell you it's going to be 100% because it's not. But it's a whole heck of a lot better than it was when we first started.
All right. Overall, then, your experience with StemWave, Shockwave, glad you did it. What do you feel?
I would have to tell you, and just this is for people to understand the process of it. If you'd have asked me this probably 2 weeks ago, where we were at the 6th or 7th treatment, I would have said, I'm not sure it was worth it. But these last couple of weeks, I'm like, I've really noticed
that regenerative ball is rolling.
Yeah, well, I think it was probably starting after about the 7th or 8th treatment. I noticed that, wait a minute, I'm not noticing my knee near as much as I was. And this past week is when it kind of really hit home. The last probably 4 or 5 days, I'm like, I'm walking with very little pain.
Yeah.
And so yeah, in this case, I'd say it's been worth it for me. Somebody else have to figure that out for themselves, but it's been worth it for me.
Well,
and I do want to say this for anybody that's watching this. I want you to know that I've been coming here for years, and I don't know anybody who cares for his patients more than Dr. Culleton does. And he tried it on himself first to make sure it was going to give value before he, tried to use it on his patients. So that's why I felt confident doing it.
Well, and your check's in the mail for that. I appreciate that. It's kind words.
He is not paying me for this.
Well, yeah, and I did have some knee issues myself, as you knew, and I had a similar experience, to be honest. It was a couple of treatments in. I was like, I don't know. But then I really have to now think about what I used to be able to do or what I struggle to do, just lifting my foot up to put my shoe on. I don't think about that anymore.
Yeah.
And that's where it kind of hits on. But okay, we're going to go ahead and get the last treatment in, but I do appreciate it, and thank you for sharing your experience.
And by the way, the treatment is not painless, but it is not exceptionally painful. And after it's over, you do feel better.
That's great. Yeah, we try to keep it at a below a 5 out of 10 during the treatment, and it's momentarily. But yeah, that's a great point.
Yep.
Okay, thank you so much, Ray.
Okay.
Bye.